the unseen struggle, a medical odyssey begins. Have you ever felt like something was wrong, but you couldn't quite put your finger on it? Maybe you've experienced persistent fatigue, unexplained pain, or a nagging feeling that something just isn't right. This is the reality for millions of people who find themselves navigating the complex and often frustrating world of undiagnosed or misdiagnosed health conditions. This journey can be isolating, disheartening, and fraught with misunderstandings, both from the medical community and from loved ones who may struggle to comprehend the invisible battles being fought. Imagine feeling unwell, not knowing why, and then embarking on a quest for answers that feels more like a maze than a straight path. This is the unfortunate reality for many individuals who find themselves seeking medical help, only to encounter a system that can sometimes feel impersonal and overwhelming. The process of seeking a diagnosis can be daunting, involving multiple doctors' visits, a battery of tests, and often conflicting opinions that leave patients feeling confused and hopeless. The experience of feeling unheard or dismissed by healthcare professionals is unfortunately not uncommon. Patients often report feeling rushed during appointments, their concerns minimized, or their symptoms attributed to stress or anxiety. This lack of validation can be incredibly disheartening, especially when dealing with chronic pain or debilitating fatigue that significantly impacts daily life. The first step in navigating this challenging terrain is acknowledging the reality of your experience. It's crucial to remember that your pain is real. Your struggles are valid, and you deserve to be heard and taken seriously. Don't let anyone, including medical professionals, dismiss your concerns. You are your own best advocate, and your voice matters. In the following sections, we'll delve deeper into the specific challenges faced by individuals with undiagnosed or misunderstood health conditions and explore strategies for effective communication, self-advocacy, and finding support along the way. Doctor shopping. A search for answers. The search for a diagnosis often involves consulting multiple healthcare providers, a process commonly referred to as doctor shopping. While this can be a necessary and even fruitful endeavor, it can also be emotionally draining and financially burdensome. It's not uncommon for individuals with complex or rare conditions to see a string of doctors, each with their own area of expertise, before finding someone who can accurately diagnose and treat their condition. This process can take months, even years, as it did with me, and the uncertainty and lack of answers can take a toll on both the patient's physical and mental well-being. Imagine going from one specialist to another, each visit bringing a glimmer of hope that maybe this time you'll finally have an answer. You recount your symptoms, undergo more tests, and wait anxiously for results, only to be met with another dead end. Or a referral to yet another specialist. The cycle can feel endless, and the emotional roller coaster of hope and disappointment can be exhausting. This is the unfortunate reality for many individuals who find themselves caught in the loop of what I call doctor shopping. The frustration of this process is compounded by the fact that medical records don't always seamlessly transfer between providers, leading to repetition of tests and procedures. This not only adds to the financial burden, but also prolongs the diagnostic journey, delaying much needed treatment. The lack of coordination within the healthcare system can be a significant source of stress and anxiety for those who are already grappling with the uncertainty of their condition. It's crucial to be proactive in your search, seeking out specialists with expertise in your particular area of concern. Don't be afraid to ask for referrals, research doctors online, and read patient reviews. At times, you must be a pest, calling the office over and over again. Remember, you have the right to seek a second, third, or even fourth opinion until you feel heard, understood, and confident in the care you're receiving. The frustration of conflicting opinions. One of the most disheartening aspects of seeking a diagnosis is encountering conflicting opinions from different healthcare providers. I would often receive a diagnosis from one doctor only to have it questioned or even dismissed by another. This can be incredibly confusing and frustrating, leaving you feeling unsure of who to believe or what course of action to take. It's important to remember that medicine is not an exact science, and there is often room for interpretation, especially when dealing with complex or rare conditions. Conflicting opinions can arise from various factors, including differences in training, experience, and even personal biases. It's crucial to remember that you are the expert on your own body and your own experience. Keep detailed records of your symptoms, tests, and diagnoses, and don't be afraid to ask your doctors questions about their reasoning and recommendations. If you find yourself facing conflicting opinions, it's essential to advocate for yourself and seek clarification. Don't hesitate to ask your doctors to explain their reasoning, the evidence behind their recommendations, and any potential risks or benefits of different treatment options. You can also request a second opinion from a different doctor or specialist to gain a fresh perspective on your case. Time lost, life on hold. Living with an undiagnosed or misdiagnosed health condition can feel like life is on hold, but you must keep living. The uncertainty, the pain, the limitations, they all take a toll, making it difficult to plan for the future or even enjoy the present moment. The constant search for answers and the struggle to manage symptoms can consume your time and energy, leaving little room for the things that bring joy and meaning to life. Imagine having to put your dreams on hold, your career aspirations on pause, your social life on the back burner, all because you're grappling with a health issue that no one seems to understand. This is the reality for many of us living with undiagnosed or misdiagnosed conditions. The impact of our personal and professional lives can be profound, leading to feelings of isolation, frustration, and even despair. The financial burden of medical bills, lost wages, and the cost of alternative therapies can add another layer of stress to an already challenging situation, including stacks and stacks of medical debt. Despite the challenges, it's important to remember that you are not defined by your illness. It may be a part of your life, but it doesn't have to be the whole story. Hope is the currency of the chronically ill. Keep fighting, keep living. Comment, like, and subscribe for more.